Good evening to everyone.
Good evening, Doc.
Good evening. Good evening.
How has your week been?
Stressful, but we are managing by the grace of God.
Today, I intentionally decided to come some minutes late, and as at 9 minutes after 3, the class is 342. Please, the person Mary Kojo say, Mary Kogo say, whatever, no. Mute yourself. Say, please come inside. You don't know that you are in school. All right. What did you take home last week? You should know that me, I'm marking register. Attendance is very important to me. So those of you that have not been attending class, What did you learn last week? Yes, Belinda.
Last week, I learned that the key historical development in Ghana, the community health nursing, started in the year 1920s to 1950s during the colonial beginnings. And during that time, a lot of nurses were visiting homes and offering health education, that is the preventive services to the community members to help them improve their health. And also from the year 1960s to 1970, they started the community clinic attendants, and the TBAs were also given the mandate to extend care following the 1978 AMA-ATA declaration. So the TBAs and the community, they engaged, and the TBAs were rendering the maternal health services to the people that needed those services among the community members. So this is what I got from what you taught.
Okay, thank you, Belinda. Any other? Any other? Yes, Osman Rabiatu.
Hello. Good afternoon. Hello. Hello.
You want to answer question? Yes. What is the greeting for? Haven't we greeted ourselves? Madam Rabiatu.
Yes, we did. I just came online. My work was not good. Sorry. Please, what I learned was in 1990s, the Ghana Health Service and the teaching hospitals implemented the CHIPS initiative. That's what I learned last week. Thank you. Thanks.
Any other? Your index number is 2762. 2762. 6225. It will come in handy in future. Any other? All right, so if there are no issues, then this afternoon, we are going to look at the Unit 3. We are looking at the Unit 3. So last week, we started Unit 3, but I am taking you back. we started talking about the concept of health and wellness, where we defined health using the preamble of the World Health Organization's Assembly in 1948, which states that health is the state of complete physical, mental, social well-being, and not merely the absence of disease or infirmities. We got to understand that the word completeness brings issues with regards to having a particular human being who is complete. Nevertheless, this is what has been accepted worldwide. However, depending on the discipline you are coming from, you can also define health to suit your discipline. Then we looked at the models of health, looked at the determinants of health, and then looked at attitudes people have towards health. Then we zoomed in into the unit 2, where we also looked at the concept of community health. And here we looked at the historical perspectives. Then we came to look at the definition of community health. Then we looked at the components of community health, then community health problems, community approaches to health disparities, and then we ended with the levels of prevention. This week, we are looking at Unit 3, where we will be looking at community entry and diagnosis. And here, we will try and look at the definition of community. Then we have a quick glance at the subsystems that make up a community. Then we'll try and define community entry. What is it? When we say somebody, when we talk about community entry, what are we talking about? Then why is it important for you to enter into a community as a health officer? And then we try to look at the definition of community diagnosis and how to diagnose a community. Welcome to the third unit and the first session of the third unit, where we are trying to look at the definition of a community. Many people have defined community, and so you are at liberty to also look for the definition of a community. And then based on the definitions of the community, you can now write your own definition of a community. For this purpose, I have only 2 definitions, where I say that a community is a cluster of people with at least one common characteristics. You need to understand that for us to say something is a community, it should be a cluster of people who have at least one common characteristics, which can be geographic location. So your geographic location, like Bantama community, Ashanti Newtown community, African Bungalow in Shiaso, Abrepo Janj, Abrepo Kese, Abrepo Kuma, Atafua, Oshim, Oshimase, they are all based on geographic location. And then occupation, the nursing fraternity, the nursing community, the midwives community, you are being identified as a community by your occupation. And ethnicity, the Dagombes, the Kusasis, the Ewes, the Fantis, the Achems, the Kwaus, the Ashantis, the Bonos, and then housing conditions. So we can say affordable housing, that's net housing. Then another way of also defining a community is to say that the community is a group of people with a common characteristic of interest, a common characteristic of interest living together within a larger society. Within a larger society. What then are the subsystems in the community? It brings us to the session 2 of the unit 3. Subsystems in a community. What are the subsystems that make up a community? In every community, these all right. I welcome myself back. I welcome myself back. It says internet unstable. Let me check. Let me check and see. All right, let's manage it. If you see a noise, forgive me now. Artisans, you give them time to come and do something, and they decide to come with their own time. So don't ignore the background noise. All right, so let's look at the subsystem. The subsystem. When you talk of communities, we should have the physical environment. So those of us in our communities, depending on where you are, the suburbs or the community you find yourself, you see that the physical environment is there. The physical structures, buildings or slums or whatever have been erected. Then we have education. When we talk of education, we are looking at the educational facilities. So the educational facilities such as the crèche, the daycare, the nursery, the elementary, the basic, the upper primary, the lower primary, and the rest. So there is education. Then safety and transportation. When you talk of safety, we are looking at the security services available within the community, the transportation, the commercial, the government, as well as the private transportation. Then when you talk of politics and governance, we are looking at the politics, the political space, as well as the rulers, the traditional rulers and stakeholders in the community. Then health and social services. What health facilities are available for the community, and then the social services that are available for the community. Then we have the communication. These days, because of mobile networks, during the olden times, you can see telephone cables all over where there was analog telephone facilities. Then economic trading, the kind of trading and economic activities that goes on in the communities. And then recreational facilities. These days, things are springing up. Gone are the days that Kumasi was so dull. These days, Kumasi, we even have what we call splash, where you can go with children to go and play in water, etc., etc. All right. So having looked at the subsystems in the community, let's look at the definition of community entry. When we say that you are to enter into a community, when you hear of community entry, are we looking at the physical aspect of you picking a car and going into a community, or what does community entry entails? On the journey to the definition of community entry, I want you to understand that community entry is not just picking a car and going into a community, but community entry is the process. It is a process that takes place. So community entry is a process of initiating a relationship. When you initiate that relationship, you need to nurture that relationship. You need to build that relationship and then sustain that relationship with the purpose. The reason why you are sustaining a desirable relationship as a health official is that you need to secure and sustain the community interest, especially when you are going there with a program. And therefore, you should learn to establish good rapport and good relationship. And when you go to a place initially to establish a relationship, a working relationship, you should understand that you are doing it for future generations as well. You are a newly midwife that has been posted into a community that did not have any midwife. And you are going to be the first midwife in the community. How are you going to work with the people in the community, you need to initiate a relationship. So those of us that are working and think that we don't want to initiate any relationship is one of the professional calls. We need to enter into a community. And when we talk of community entry, we are looking at a process whereby the individual initiates, nurture, and sustain a desirable relationship with the purpose of securing and sustaining community's interest in all aspects of the program. We can also say that it is the process, principles, and techniques of community mobilization and participation. And so what does this initiation, nurturing, and sustainability of a desired relationship, what does it entail? It entails your ability, or it involves the health professional's ability to recognize the community. And you can only recognize a community when you also recognize the leadership of the community, the people within the community, their norms and their beliefs and their perspectives, and adopt the most appropriate process in meeting, interacting, and working with them. And this is where most of us fail as health professionals and even fail as individuals. If you can work with a community, you first of all need to recognize that the community exists. And then you need to acknowledge the leadership of the community and try to also get to recognize the people in the community based on their norms, their beliefs, their cultural perspectives. It's very important. Even the Bible says that can two work together except you be agreed. And if you can agree with somebody, if you can work with somebody, then you need to take the pain of getting to know the person, getting to know and recognizing the community. This is a community. This community, their beliefs as far as antenatal care is concerned is low. Their belief as to attendance to skill delivery is low. And these people believe that their stakeholders, such as the chief or the odikro or the linguist or the religious leaders, have power over them. And so when you get to know these things, as a health professional, you will know how to strategize to work with the community. A community that believes in home delivery, yes, with somebody who is not skilled, is more dangerous than a community that accepts skilled delivery. And therefore, there is the need to recognize the community. When you acknowledge that this is what the community stands for, then you, the professional, will use any appropriate processes in meeting, interacting, and working with the people. And so before you go into a community to work, before you go anywhere to work, you must be able, or there is the need to identify the community. And you can only do that by gathering information. And this gathering of information can either be through formal or informal means. Formal means you can read literature. If there's something that has been written about that community, you can read to get to know more about the community. You can also talk to knowledgeable people, people who also know stuff about the community. And then you can also use informal sources. Sometimes you can go to the marketplace, informally, the drinking bars, funerals, and other festive occasions, just to get information or get to know the community and the terrain that you are being sent to go. It is very, very, very important, because you cannot go somewhere that you don't know. Then you'll be always causing chaos and problems. You need to even know the do's and the don'ts. I remember I went to one community in the year 2000s, the 1999, 2000. We went to a community in Wa, the Funse district to be precise, the Bofiama community to be particular. And then when we got there, we were tired and we wanted to sit somewhere, and people ran quickly to us, please, here, women don't sit there. It was a lesson. So it means that you cannot just go into any community and start lording over people or talk about something when you do not have knowledge about the community. And so when you are able to initiate and nurture and sustain the relationship, your task as a health officer is to set up meetings, know community priorities, and link with opinion leaders. Know community priorities. You realize that communities, in typical rural communities, they share a lot of priorities. They have a lot of priorities. Whatever you think is important to you might not be important for them, and therefore you need to know the community's priorities. Any questions at this point? Any questions or any contribution? Maybe your experience of entering a community, you raise your hand and then you share with us. This course is supposed to be one of the interactive classes, because we are going to dwell so much on experiences. So what is your experience when you were first posted to your community to work? Share your experience with us. What happened? Anybody to share their experiences? Anybody? I don't like a dark class. You people don't like talking. Any questions, any contributions? All right, so what are the skills that are needed? What are some of the skills that is needed for you to actually enter into a community and become successful? One of the skills is that when you enter the community, when you are able to meet the stakeholders, when you're able to meet the community people, you should maintain a good eye contact. You should maintain a good eye contact. When there are issues, when issues arises in the community, you should learn to listen to both sides of the issue in order for you to have a fair judgment. You should paraphrase the information and then show interest. These days, because of mobile phones, people do not show interest whenever there is a conversation. You see people on their phones and whatnot. You need to show interest and you need to be empathetic. Put yourself in the shoes of the people. You have been posted to a community and you realize that these people do not attend ANC, The few that attend A and C do not deliver in the facility. They prefer to deliver at home, or they prefer to deliver at the TBAs. Before you place a judgment on them, pause and put yourself in their shoes, especially if they are having a health center for the very first time. You will understand where they are coming from. And then when you are also talking, encourage others to listen. These are some of the few skills that I have shared with you. You need to have some attitude. You need to have some form of attitude and to work in a community, to be able to initiate a relationship and nurture that relationship and sustain that relationship. You need patience. A lot of us here don't have that patience. When they even attend a lecture and something is done, like a group is shared and they don't have one, even when the lecturer assures them, they still don't have the patience. Learn patience. When I say it, my students will be laughing. Patience is a virtue. Patience is a virtue. Because of patience, Saul forfeited his throne. Patience is a virtue. And so learn to be patient. When they say wait, learn to wait. You see, waiting is not difficult. It is the patience that you need whilst waiting. That is the challenge. Then, tolerance. Patience is not the same as tolerance. In Twi, patience, they will say patience is abotere. Then tolerance, they say abojochare. And so, for yes, patience, yes, you need, but you need to have that long suffering thing, that long thing, that rope, long thing. When I say it, then my CODeL students will be laughing. If we don't have, some of us, if you don't exercise that spirit of tolerance, hey, because some of you, as grown as you are, once the name student is placed on your head, is another wahala for another day. All right. Then respect for other people. You don't need to know somebody before you show that somebody respect. No. You need to show people respect, irrespective of who they are. So sometimes you see that on the platform, on the WhatsApp platform, people sometimes come to disrespect the lecturer. Then the next minute, somebody tells the person that, hey, this is a lecturer. Then the person comes to the person and says, I don't know. You don't have to be saying that. You need to have respect for people. You don't have to know who that somebody is. Then you should have a good listening attitude. Listening attitude. We don't listen with our ears alone. We listen with our every senses. And so let's have that in mind. And then humility. Humility is not, please, good morning. Humility is not, oh, please, how are you? I'm fine. Humility is not when you disrespect somebody, but when the person is coming, you want to go and collect the person's bag for the, no. And humility is not about full respect. You know that full respect? You don't respect the person, but you pretend that you respect the person. That is not humility. Humility is discerning, going down at the level of people and trying to understand people and also have respect for them. Any questions or contributions at this point? I need to be fast because it looks like the light will not be coming and my laptop is also at a certain point. Okay, so why is it important as a health officer, as a health professional, to observe the community entry process? Why, how important is this? Then we say that yes, she put her hand down. Simple. Okay. So we say that community entry is important because it ensures the establishment of good working relationship. One thing I've observed is that with CODeL students, you, the lecturer teaching the CODeL student, tries to understand the CODeL student, but the CODeL students refuse to understand you. You see, the moment you meet a lecturer, you realize that the lecturer will tell you their do's and their don'ts. You get to know that this one, if I do this, I am safe with the person. That will help you establish a good working relationship. The relationship between students and lecturers is student-teacher relationship. That ends it. There is no friction because you should be comfortable enough to approach the lecturer if you are even having issues with your studies. It is not war. You just have to understand the lecturer. When I say it, my students will be laughing. When you come to my DM and then you just type, "Good evening, doctor, I don't have a group." I mean, is it the right thing to do? You first of all have to introduce yourself, who you are, before you talk. Sometimes students call, hello, I didn't agree. No, you need to first of all introduce yourself and then talk. That is how come sometimes some of us, we will have the same issue. Two people will have the same issue, but because of the way the first person will communicate, you realize that the person will be attended to and you will not be attended to. It's not about favoritism, it's about how you carry yourself. So let's enter the community well. Then it also helps one to plan his or her work, because if you get to know the community priorities, if you get to know their busy days, you get to know their taboo days, you can plan your work around them. And then it also helps you to observe protocols. I don't know whether you've gone to Menshia before, but I tell you, in the Ashanti Kingdom, if you are afraid of shouting, if you are afraid of doing the right thing, not doing the right thing for people to correct you, then don't go there. And a whole lot of things. But when you're able to understand the place that you are going, you will be able to observe the protocols. When we went to Bofiama, they brought us they brought us water in a calabash. We drank. They brought us TZ. We ate. They brought us yam. We ate. You will not go there and tell you see, when you are working in the community, those that are working in the community, if they decide to share their experience, you realize that the community work is a different ball game altogether. You cannot work in a community and go and claim supremacy. You will not get anybody to work with. You cannot go to a community to work and pretend as if you migrated from the heavens. No, you need to go there, accept people, tolerate people, have the patience to work with the people so that the people will enjoy you. Any questions at this point? Any questions, any contributions at this point? Questions, contributions at this point? Questions, contributions at this point? Then let's look at the fourth. So if you find it, let's look at the fourth unit. I am lecturing. So those of you that think that the third unit, let's look at the third unit. Let's look at the third unit. And what does the third unit talk about? The third unit, session 5. Unit 3, session 5, we are about to define community diagnosis. When we say you are diagnosing a community, what is it? We are saying that it is the identification and quantification of health problems in the community. So when I say that you are diagnosing a community, you are going into the community to identify their health problems, try to quantify the health problems in terms of mortality and morbidity rates and ratios. When we get to epidemiology, you calculate mortality rates, you calculate morbidity rates. That is what we use to diagnose a community. And so in the process of diagnosing the community, it is the examining the aggregate and social statistics, those of us that don't like mathematics, in addition to the knowledge of the local situation, to determine the health needs of the community. You have been posted to the Ochemberiate community. You cannot just get up and then do whatever you like. That is why I said that you have to know their priorities. And then along the line, you need to identify and quantify the health problems in the community. This will also help you as a health worker to prioritize the needs of the people together with them. So you are a midwife and you've gone there. Definitely every midwife will be passionate about ANC attendant, skilled delivery, and so forth. And so as you get in there, you need to examine the aggregate and the social statistics of these things in addition to their local knowledge. The reason why we emphasize on the local knowledge is that people in the urban, people in the peri-urban, people in the rural communities, and even the rural communities have not the same knowledge. They don't have the same local facilities, and therefore you need to understand the terrain you find yourself in before you can actually help the people. So the goal, some of the goals of community diagnosis is to analyze the health status of the community. And then it's also, the goal is to evaluate the health resources, the services and the systems of care within the community. And also, you are interested in assessing the attitude towards community health services and issues among the people. And so when you diagnose the community, when you identify and you want to quantify the health problems, you then analyze the health problems. And here we will Portia say, Nyame no, say whatever. No. Why is your video on? Auntie? Portia, why is your video on? Asa shwa etiri mi bebrebe we di egu utiri so te say the. So what is the thing for? Oh, we here cry, mama nko here. Also video henche EDSC esu. Oh, okay, no. Well, when it's training. So the training to my friends say baby here. What is it, Portia? Nane ye. Say what a pragia moo, say what yellow moo, say dear no what moo. You. So when you want to analyze the community, you do the community analysis, you have what we call you have what we call the, let me charge my. So you have to examine whatever data in terms of the needs of the community, the barriers, the opportunities, the readiness, and the resources. And when you do that, it is called, the product out of the analysis is called community profile. It's called community profile. I didn't say if you want to ask a question. I have muted everybody. You raise your hand and I will unmute you. So when you raise your hand and you put your hand down, you can't unmute yourself. I don't want any story. So in my class, I always mute everybody and deny everybody the access of talking. So if you don't raise your hand, well, I cannot give you access. So you can raise your hand for me to unmute you to ask your question. Or they say, Baba, Habiba. So when you raise your hand, keep the hand there. And then I will unmute you to talk. Otherwise, you can never unmute yourself. I have applied the rules here. All right. So how do we diagnose a community? How do we identify the health problems in the community? We use what we call the health indicators. We use what we call the health indicators. And the health indicator that you have to use to have these characteristics, it should be valid, it should be reliable and objective, it should be sensitive to change, it should be specific, it should be feasible and relevant. When we say it should be sensitive to change, let's assume that you went to the community and then you diagnosed that attendance to antenatal care is low. And then you use some form of intervention in the community. When you come to measure attendance to antenatal care again, there should be some form of improvement. Then relevant. It is not everything that you go and measure. You go and identify and quantify. It should be relevant to you. So what are some of the indicators? We have the mortality indicators, and the mortality indicators for midwifery, example of mortality indicator is the maternal mortality ratio, the infant mortality rate, the neonatal mortality rate, and all those things. Then we come to what we call the morbidity indicators. When you talk of morbidity indicators, examples are the prevalence rate of a disease, the incidence rate of a disease, and then we have the disability rate. Here we calculate the number of excuse duties that you take, the number of working hours that you lose doing work. Then we have the nutritional status indicators, where you also look at the anthropometer and also talk about head circumference and the rest. Then the healthcare delivery indicators. The healthcare delivery indicators. Then we have the utilization rates, the number of persons that have attended ANC, and then the number out of the number of the persons that have attended ANC, the ones that attended to scale delivery, the number of postnatal. This class na ankasa, I don't know, I'm saying we deviant kakra. So obi na wa show ne dey and then was say enya ne dey. The video no better dapa, and it looks like all of you want to be heard. You want your name to be as a mope ibisa. Attention. Somebody puts on the video, we say it now, swab be put you there on. We better for what exactly? Then utilization rates, as I said. Then we have what we call the indicators of social and mental health, homicide, suicide, and the rest. The environmental indicators like vector density, the health policy, socioeconomic indicators such as poverty, illiteracy rate among women. The reason why we are always interested with the literacy rate among women, realize that majority of caregivers of children under 5 are women, and therefore knowing their illiteracy rate is very, very important. Then we look at the health policy indicators, the gross national product, that is health economics, the gross national product that has been apportioned to the health sector and so forth. And then we have the indicators of quality of life, what makes the life, what quality of life, example, the life expectancy rate, and then other indicators. Any questions at this point? Any questions at this point? Any questions or contributions at this point? All right. Idris, you have been unmuted. Unmute yourself and talk.
Doc, please, good evening. I'm currently in one. Hello?
We are listening.
Hello? Okay, Doc, in one community in which I'm working there as a midwife, there are these men who come to sit under one tree. And they come in session. These people, as early as 5, some will be there. Then get into maybe at 9, some will come. They will sit in session till in the night, even some at times 12 a.m. Another session will come. And it's making my family planning. The women, they don't want to attend. And they are all, and some of them are sub chiefs, they are grown people. So I don't know how to approach them. So I want to see how
You
you
don't
can
want to
help
know how
me.
to approach the people. But
They are sub
stakeholders
chiefs.
are part of the people that go and sit there. So have a one-on-one
Yes,
conversation with the stakeholders. The stakeholders that are part of the people that come to sit there. Do you know why they come to sit there?
they just sit to chat. They chat there, people will cook and bring food and they will eat. There's one big tree there, so it's shady a bit.
So you will realize that they don't sit there intentionally, and they might not even know that their sitting is affecting your work until you have a conversation with them. They might not know. You are maybe assuming they should know. And that is one thing that we Africans here we do. We always assume that people should know things. No, we need to voice it out. They need to know. So there, you said there's a sub chief even in there. So get the opportunity to have a one-on-one talk with that sub chief, and let the sub chief know the implications of they came to sit under a tree for shade, but it is actually affecting the work of the midwife, because these women do not want to come in for their husbands or their husbands' friends to know that they are doing family planning. So you need to act, and the act that you have to do is to go to the stakeholder who is also part of the people that come to sit and initiate a conversation with the person. And as you do that, you realize that they don't even know that they are sitting in there affects the work. So just try that and let's see how it goes. All right, yes, Belinda, your hand is up. You have the access to talk. Belinda, you have been given the access to talk. Unmute yourself. Or she doesn't know her hand is up. Any other issue? Mm-hmm. All right, so if there are no issues, let's move on. Let me try and see if I can get one preamble on the community entry thing so we can look at it. Okay. I'm coming. I think I've seen one. When we finish, then I project it there. Okay, we are done, so let me project it. About the preamble. Before we get to Unit 4. I get to Unit 4. What I'll do is that I'll put the preamble on the WhatsApp platform now. Then this is individual work we are doing. I just want to know whether you understand what's occurred. Tell the people that do not attend lectures that when I put it there, nobody should come and ask me whether it's an assignment. It's a class exercise I want us all to try our hands on. If there's something I don't do, I don't answer unnecessary questions. I realize that CODeL students' attention is 0. So they always want to ask unnecessary questions. So this was a preamble. With the preamble, January, cohort, April, so that is it. January 2026. January 2026 cohorts. So take it to the PDF file and then send it whilst we sit here to look at it. Cohorts. Okay, we have some minutes to do this. We are doing it in class. I just want you to have okay. All right. We want to look at community entry, so I have quickly put together a preamble. So this is the preamble. I am also putting the Word version on the platform so you can read it. Well, Dorcas Anom. Hey, and the places that they are showing to are not beautiful. That's what they do. Midwifery for Nankasa. I have no idea, but Maswadi. You always want to misbehave and create unnecessary attention. And Angelina, and so I what that one pass. I'm teaching you, are lying on your bed and you put on your video. What that one pass instead of sitting down and you are lying on your bed and you put on your video. Hey, reps, speak with your people. Me charge you on muswa. Monya comfortable crowd. Why do you create unnecessary attention for yourself? We are in a class doing serious business. You are lying on your bed and you take a decision to put on your video. You are lying on the bed. And you're my fault. You are lying on the bed and you have the audacity to put on your video. The moke lecturer and answer there. I should also go and lie on my bed and be teaching. If they don't worry, they will not comport themselves. As for every class, you have people that are deviant. You have people that will always create issues for the class. You have people that think that they are chompiata and they think they can do whatever they like. Anyway, so this is the preamble. In the RECOM community has a market, a primary, elementary, junior and senior, junior high school and senior high school. The primary school has a big park where the indigents of the community play football and also use it for other community activities. The community members also visit the hospital with many illnesses, but most common ones are malnutrition in children under 5, malaria in children under 5 and pregnant women, hypertension in older adults, and sexually transmitted infection among adolescents. The adolescents also engage in social vices such as gambling, drinking, and smoking. Attempted suicide rate among adolescents is 5%. The prevalence of malaria is 45 per 1,000, and then maternal mortality is 243 per 100,000 live births. Utilization of ANC is poor with a rate of 20%, and skilled attendance delivery has 10% coverage. The people healthcare seeking behavior is poor. However, the people are ready to adjust with the right health education and promotion strategies. The environment is enriched with green vegetation, with common foodstuffs such as corn, groundnut, beans, palm fruits, melon seeds, and kontomire. And then fruits such as orange and pineapple are in abundance in the community. There is also a river that also have some or that produces herrings. Now, your task is that you are to use that preamble above to write a community profile for the ERICOM community. So the first thing you have to do is that you have to actually gather the demographic data of the community. Then the question 2 is actually based on the preamble that you have, tease out the health needs of the people. Then the question 3, you have to look out for the common health problems in the community. Then the 4, you look at their health strengths. The community have health strengths in the preamble. And you also have to look for the health barriers of the community. And then the health opportunities in the community. Then tell us about the community's readiness and community resources. Let me give you some 10-15 minutes to find yourself in the preamble. I have put the preamble on the WhatsApp platform. I just put it on the WhatsApp platform. So you can open it and then when you are ready, raise your hand so that you tell me what you want to say about the preamble, what you have found out. You can answer any of the questions. So when you are ready to answer any of the questions, let's raise your hand. We are trying our hands on the preamble about what I just taught about community diagnosis. Community diagnosis, identification and quantification of problems. So community diagnosis. So you raise your hand and then I'll give you the access to talk. All right, let's hear from you, Belinda. I hope you are able to unmute yourself this time.
Yes, sister. Sorry for the first time, it was the network. Hey, yes, Doc. Please, from the preamble, I want to talk about the fourth point, the health strengths. From the preamble, I can see that the community is blessed with one health center which is able to take care of their women, the reproductive age, and the pregnant women in that group, because they have adolescent health services they also render to the adolescents. And from this preamble, I can see that the maternal and the child health and the children under 5 issues are solved, and they can it can also help them to improve their health. So this is what I want to see.
Thank you, Belinda. Yes, Teresa, let's hear from you. When you raise your hand, I give you the access to talk. If you don't have the time, please don't waste our time. Because we'll be enough for
Doc, please, Doc, please, I would like to talk about the common health problems per the preamble. So per the preamble, the community has malnutrition in children under 5, and then malaria in the under 5s, and then pregnant women, hypertension in the older adults, and then sexually transmitted infections among adolescents.
Thank you. Your baby is making noise. Praise. The moment I mention your name, you should know that I've already given you that access. Okay, she's gone. Araba. If you don't know how to unmute yourself, please don't raise your hand. We have serious business here to do.
Hello, Doc. Good evening. Please, I want to talk about the health barriers. And one, we have poor utilization of ANC service, that's 20%. And we have no skilled delivery attendance, that's a coverage of 10%. And we also have poor health seeking behavior and high maternal mortality. Thank you.
Please, let me also thank you. Let me tell you people this. Please, when you come, don't greet us. We already greeted ourselves before we started the lecture. Don't greet us. Why are you not do? Yes, Ruth.
Doc, please, I also want to talk about the community resources in the preamble. And per the preamble, they said they have one health center, that is the health resources. And they have social resources like the social welfare support agency. And they also have educational resources, that is the primary school and the elementary school that they have. And they have environmental and economic resources, that's the community market, the football park, and the recreational grounds. Thank you.
Thank you, Ruth. All right, let's listen to Vida. Let's listen to Vida. Okay, let's listen to Priscilla.
Okay, Doc, thank you. Please, I want to talk about the health needs. So according to the preamble, the elderly people report to the facility with high BPs, hypertension, and the rest. So they need professional management of chronic diseases. And then with respect to the maternal deaths too, they need professional care for maternal and obstetric care in general. And then with respect to the malnutrition in the kids as well, they need professional nutritionists to help them with their nutritional support. Thank you.
Thank you, Priscilla. Let's hear from Jennifer.
Okay, I would like to talk about the health opportunities. And then with the health opportunity, they said the schools can serve as platform for health education. And then the community centers can be used for outreach programs. The social welfare agency can support the vulnerable groups too. Thank you.
The reason why I'm sitting here and I am smiling to myself because you have understood the stuff. So this is how we are going to be rolling. Realize that when we roll like this, you're able to understand because there's a little bit of practicality with regards to the preamble. Yes, let's hear from you, Matilda.
Okay, doctor, I also want to talk about the demographic data. Ericom community is a rural community situated at the forest belt of the southern zone with a total population of 3,350, of which 750 are women in their reproductive age, out of which 190 are pregnant women. 250 of the women in their reproductive age have children under 5 years old. 330 are children of school-going age. 960 are adults aged 10 to 19 years. 300 are young adults. 350 are older adult women. And 200 are older adult men. Thank you.
Thank you. Have you not answered all the questions? Which one is left? Let me look at the question. Demographic have been answered. Health needs, common health problems, health strength, health opportunities, readiness, and community resources. Okay, Portia, let's hear from you.
Please, I would like to talk about the readiness. So it says that their health seeking is very poor. However, if they are able to adjust with the right health education and promotion strategies, which means them coming to seek the health seeking from you is a little difficult for them. But then with the help of outreach and we going to them, they are able to adjust and they are willing to listen to us. And then to add to their strength, it talks about them having fruits enriched in green vegetables, common foodstuffs such as corn, granite, and etc., which also shows that the community have all the resources that is going to help them stay healthy and eat rich and be healthy as well. I think that also adds to their health strength, which can also serve as their resources because they can sell it and sell it to other people to get funds to take care of themselves as well. Thank you.
Thank you. You've understood the assignment. At least I hope that you can do this in exams as well. Yes, Florence, do you have anything different for us?
Okay, sister, please, I want to talk about the health strength. I think according to the preamble, we realize that the community have presence of hospital within their hospital that the members visit, and also they have availability of schools, and the schools can be used to educate for education or health education, and they have community park that can be used as a source of physical activities over there. They also have market access to markets that It can also be used as health promotion for the community members. Thank you.
Thank you, Florence. I hope Helena has something different. Helena has something different.
Yes, Doc. Please, I want to talk about the community resources. Please, according to the preamble, the community have one health center that provides ANC and child health clinic and adolescent clinic. And it also has one private hospital. The community also have social welfare agents, and police station, community and recreational center. And the community also have primary school, primary markets, elementary and junior high schools, and even have senior high schools. Thank you, Doctor.
Thank you, Helena. So let's listen to Ivy and lastly, Olivia. So Ivy, let's go. Ivy, I've given you the permission. Unmute yourself and let's move. If she is not ready, she can't do it. Olivia, let's go. Olivia, unmute yourself and let's go.
Doc, looking at the community, you can see that it's a vibrant community when you look at the demography and the number of people who live in the community, because they have about 960 adolescents and then they have young adults as well, meaning that if someone enters the community and is able to affect the lives of these people positively, it is going to attend to a larger generation because most of them are young adults and adolescents. Thank you.
Thank you. And thank you all for your participation. Thank you all for your participation. I am taking the preamble off from the platform. Okay, so it was just for exercise. I wanted people to have a view of it and be able to do what they wanted to do. All right. All right, thank you. So this afternoon, we have been looking at the Unit 3. We have been looking at the Unit 3 where we looked at community entry and community diagnosis. And we said that community entry is the initiating, nurturing, and sustaining a desirable working relationship with the aim of having a workable relationship that will serve the interest of all. In other words, we say that community entry is the recognition of the community, the recognition of the people in the communities, the recognition of their priorities, the recognition of their needs, and the responsibility of the health officer is to organize meetings, link up with the stakeholders, and make sure that whatever program that he or she is going to do in the community is fruitful, acceptable, and then everybody is doing it or everybody is roped in. Then we said that the community diagnosis is the identification and quantification of health problems using health indicators. And these health indicators, one of the characteristics is that it should be sensitive to change, it should be feasible, and it should be relevant. And examples of these indicators are the mortality indicators, where we looked at the maternal mortality ratio, the infant mortality rate, the neonatal mortality rate, the case fatality rate, and the rest. And then the morbidity issues, where we look at the incidence and the prevalence rates of disease conditions in the community. And when we use these, we analyze the community based on the strengths, the health needs, the barriers, the opportunities, and thus we write in something we call the community profile. And what I just did here was that I brought one preamble, a very lengthy preamble, and then it is very lengthy, but you realize that it is easy. One of the easiest thing in intro to community health, just identifying the communities. If we had actually done the epidemiology, we would have added the calculations into it, where you calculate the maternal mortality, the utilization rate, ANC utilization, and skilled attendance to delivery, and all those things. And then if we had done health education, if you had done health promotion, then you would have been given the opportunity to also tease out one of the common problems and then outline strategies and activities that you are going to use to help the community. And then if you have done community engagement, you would have been asked to use any of the approaches: the community-based approach, the community-oriented approach, the community ownership approach, and the community-managed approach to actually bring intervention into the community. And you realize that we've done a good job. I must commend all of you that within a few minutes, you have been able to do this, and you've done it very well. I like a class that is vibrant, that is interactive, and that are on top of their issues. Keep it up, and let's keep it going. Let's keep the class alive, and let's push to do the right thing all the time. I charge the reps to keep on advising their classmates, those of them that want attention for themselves, that have been playing their videos. For me, when I'm teaching, my eyes is all over. When you put on your video, I will see. When you unmute yourself, I will see. When you absent yourself, I will see, and all those things. And so let's all have a very nice interaction this semester. You realize that I've not been able to compile the groupings for you to know whether you have a group or not. And this I hope to do. Otherwise, one of the reps who has integrity should volunteer and come to my DM, and I will give the person, or I will tell the person what to do for me, so that we get the teams going and then vibrant. On this note, we have few minutes, so if you have any questions that you want to ask regarding what we have done so far, the 3 units, you can raise your hand. I'll give you the access so you can ask your questions. Any questions? I don't want to start the 4th unit since we have few minutes to go. That's why I've left it open for anyone who wants to ask questions to ask. Not about the groupings. I've talked about the groupings already. So questions about what we discussed this afternoon. Benedict say akuto nso so say hin wonam a wo twitwa buildings de kire yen. My idea. Some of you me when I'm sitting down here I'm just laughing. You want troubles for yourself. You want troubles for yourselves. Some of you too, it gets on unconsciously. For her, Benedicta, you realize that she's roaming. She's not even sitting at one place. She's walking. And so she's not mindful. Maybe the phone is even in her bag or she's holding the thing. And so she's not mindful of what is going on. And then her camera came on. You can see that she is walking around some tall buildings. I don't know whether she's in the Kumasi Center or not. Walking around some tall buildings. That's on the Namadum. And Auntie Alice, so you can't also go on the order. Or perceive a bonny din say, Wakoso ni video. Into Alice, what is her name? Alice was Angelino. Wakoso. Meso de menya adaje abobo ama. Me wa adaje papa se class 1 teacher. So I have the time. All mischief things I will tell you in the class, and I'll even mention your name as it is because you want my attention. So me too, I'll give you the attention that you seek. All right. So I believe that we are okay this afternoon. And based on the preamble that we did, I realized that, yes, we are so much okay. When we get into community mobilization next week, when we do community mobilization next week, I will bring back the same preamble and then we use the preamble to address situation. By then, we would have the groups in place. And so we will go back to visit the preamble as a group. Every group will work on this preamble and then we take it up from there. On this note, since we don't have any questions and I don't wish to also start a new unit this evening, I think that we can adjourn the class till next week, where we come back to look at community mobilization. And so on this note, I will say that enjoy the start of your weekend and have a great start ahead of you the week before us. And have a very good night's sleep. No disturbances. A very good night's sleep. Enjoy your sleep. And we shall meet, God willing, next Friday. One of the reps who is meticulous should contact me in my DM so that that person will take the pain off compiling the list for us. Thank you, Sarah, and I also thank you for appreciating. Most lecture we 5:30, not 5. Why nie? The class ends at 5:30. When? Oh, Namon Canada day. We have more time. Where is the timetable? Somebody should put the timetable on the platform for me. Because the first timetable that I saw, it was long time. Why Janet Bachman, umpe school. Shede why na ni we emoji odi abeto. Umpe school for ne ba akono no. She emoji or the abeto. Jayara. All right, so then let's start. Let's look at the unit 4. We will not go deep, and then you have the time. Janet Bachman, Ompe School. Every time that we come, I will look for her at the participant session. Ompe School. You see about 5:30. Why be fa emoji tum di aba beto. Chere say yenko fie nkwada on. Hey, this girl. Yenko fie ni nkwada. Yenyanko. Ejina Musa Bilaba. I want to verify from the timetable. Oh, I'm Pokrao. I'm cranting and I'm on Mantemu. I at 3:30 mpo. Ah, it's 3:30 to 6 p.m. Yes. They are laughing. Oh, ow, ow, ow. Why Mary crowd, the timetable that I have, it starts from 3:30 to 6:30. So next week, I think we start from the 3:30. Why? Okay, so now then we have time. You see, when we are able to finish the lecture fast, we will get more time for tutorials and practicals using preambles, which will let the course stick better. And so the earlier we finish with the theory, the better for us. All right. Community mobilization. Now, we have entered into the community. We've gone into the community, we have initiated, we have nurtured, we are sustaining, we are recognizing the community of who they are. We've come to understand. Hey Alice, yesterday you at it. I have the current timetable. I'll put it on the platform. I have the current timetable. This year. January cohort, midwifery. Yesterday you at it. I have the current that says that this is the current updated parallel school timetable. Then the person is also using the the old timetable. Hey, munyai rough no what? Munyai rough no. It is 5:50. 45. Okay, so it's 5:30 rather. Yes, it's 5:30. It's 5:30. Well, it was Saturday I was looking at. Don't worry. It is 5:30. We still have 30 minutes. Let's do. Okay. So in this unit, we are going to look at the definition of community mobilization. I'll end with either session 2 or session 1. Don't worry. Why? So community mobilization, then the principles of community mobilization strategies, community mobilization action, community engagement, and team building and group dynamics. Team building and group dynamics. Okay. So what is community mobilization? Community mobilization is the process of engaging communities. So you've entered into the communities. You now have to engage the communities to identify the community priorities, the community resources, the community needs and solutions in such a way as to promote representative participation, good governance, accountability, and peaceful change. In a nutshell, community mobilization involves assisting the people to become more aware of their community. They are aware of their community. That I have charged there. We are all aware that we are midwifery level 300 January cohorts. Now, I am mobilizing this class because some people are deviants. So together with your reps, we want to further, identify the real needs of the community, and then believing that something can be done and must be done to meet the needs of the community. And then the willingness to use the resources available in the community to meet the needs of the community. So if we go back to the preamble that I have deleted, I have intentionally deleted it. People don't attend class, but they want to look at preamble. I know that the first people have saved it long time. Some have even screenshotted, no worry. You realize that we looked at the community strengths. We even saw that they have vegetation. And therefore, if you want to solve the malnutrition problem in the community, we can use some of the resources to actually prepare nutritious diet for the children to solve that problem. Cast your mind back to the preamble. It's about to get interesting. And so that is what community mobilization is all about. You assist the people to become more aware of the community. You assist them to identify the real needs of the community. Alice is saying that all my fans were negative fans, doc, negative fans. Assist the community, assist the people to become more aware of the community, identify the real needs of the community. You assist the people to believe that the needs that they have identified, something can be done. And if something can be done, then you have to assist them to understand that that's something that needs to be done, should be done to meet the needs of the community. And that is not all. You should also assist the community to have the willingness to use the resources available in the community to meet the needs of the community. We will bring the preamble back, and then, you see, I have taken the preamble off. I want us to have the groupings first. Then we will bring the preamble back and then look at it from what you do to enter the CRISCOM. This one is a RECOM community. What you will do in terms of diagnosing the community and what you do in terms of mobilizing the community. That will be a full-term paper for a group, each group, before we now tackle the presentations also. And therefore, community mobilization, because we are assisting the people to become more aware, assisting them to get to know their needs, assisting them to understand that something can be done, assisting them to know that they have to do that something now, assisting them to do this and that. We need some form of principle. And the first principle is dialogue. Anytime that I get to dialogue, I don't move. I stuck at dialogue. I stay there and I ask you that as a midwife, It's always a common question I ask. So today I'm asking, as a midwife that have been posted to a Chimberiate community, you went there and you realized that attendance to ANC is low. Attendance to skill delivery is low. How are you going to use dialogue? How are you going to use dialogue to mobilize the people, the principle of dialogue? How are you going to use the principle of dialogue to mobilize the people so as to encourage pregnant women to attend ANC and also attend to skilled delivery? Before you can answer this question, you should know what dialogue is. And so get to know what dialogue is. When we come next week, then you will tell me. Then another principle is capacity building. You are going into the community to assist them. And therefore, if you have to assist them and if you want to sustain this assistance you are giving to them, you need to build capacity. You need to train people to put them in charge of certain things so that all the work will not be on your shoulder. Then the third principle is the principle of responsibility, social responsibility. We all have a social responsibility in the community we find ourselves in. And therefore, we need to let people know so that they all stand up to their social responsibility to enable us to do the work. Transparency and accountability. You realize that where transparency is not, it gives room for suspicions and a whole lot of things. And therefore, whatever program we bring to the community, we need to be transparent and be accountable, make people accountable. And then sustainability. What are the plans that you are going to put in place to sustain? If it is malnutrition program that you want to start, what will be the sustainability style? And therefore, I believe that if we are able to utilize the community resources, it will be more sustainable. And then we have to include all the gender roles. When you say gender, it's not about male or female, but the gender roles and the gender identities. Who is supposed to be doing this and who is not supposed to be doing that? And then harm. Doing no harm. If I continue, somebody like Sister Bachman will be very, 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 very cross with me. So I have come back. What is dialogue? When we say dialogue, what is it? What is dialogue? Okay, Tracy, what is dialogue?
Doc, please.
Yes, Tracy.
Doc, please, it's a conversation or exchange of ideas between two or more people.
Thank you, Tracy. Idrisu, yes.
Doc, please, it's one-on-one conversation between people or group of people in order to come to an agreement to achieve a common goal.
Okay, thank you. Sarah.
Please, Doc, dialogue is when people talk together to understand each other better
not just to speak, but also to listen and respond. Thank you.
Thank you. Yes, Olivia.
Doc, please, dialogue is the exchange of ideas between two or more people to express thoughts and ideas.
Thank you. Thelma says that interaction between two or more people. Okay. And then Juliet Mabon. Dialogue is when two or more people involved in a conversation, in a communication towards a common goal. And Mubarak Mubarak says that is a conversation between two people in which they exchange ideas. And then Florence Bema Osei says that is a spoken words between two or more people. And Rhoda says it's a conversation between two or more people to achieve a goal. So it tells me that, yes, let's listen to Dorothy. Then I talk.
Sir, please. It is a conversation between two or more people where ideas, thoughts, or informations are exchanged.
Okay, thank you. So,
thank you.
Sitting at where I am sitting, it means that all of us know what dialogue is. We have established it. Now, you can take ANC attendance or skilled delivery attendance. Now, how are you going to use dialogue? You realize that in the ERICOM community, the ANC coverage was 20%, which is very, very low, and skill delivery was 10%, which is also low. How are you going to use dialogue, the principle of dialogue, to increase the numbers for both ANC and skill delivery in ERICOM community? How? Yɛwie na afei na Kurama Asare bɛkyerɛkyerɛ yɛn dialogue ɔho Irene. We brought a new question, so dialogue we are now going to apply this principle of dialogue that we are saying is a conversation between two or more people, blah, blah, blah. How are you going to use this to ensure that the story of ANC late attendance or low attendance to ANC and skill delivery is solved? Let's put on our thinking cap. Galaxy A15, aside whatever you have written, which is a no-no, never talk or type anything in my class. Phones don't type. Phones don't talk. If you want to be a student in my class, come with your official name. Otherwise, hold your peace in my class. Oh, it's the audacity for me. You came with phone name and you want to answer something in class. I'll grow when it's wrong. Yes, Idrisu.
In order to achieve the ANC attendance through dialogue, first of all, you have to include the husbands, since they are the family heads, through home visiting. Then you find out the problem, why they don't attend ANC early. Then through that, you know the problem, and you engage the husbands and solve that problem. If you are able to convince them, then the ANC attendance will improve. But if you talk to the women alone without the husbands, you may not achieve it.
Thank you. That is your opinion. Yes, Belinda, let's hear from you. Why? She can't unmute herself. Sister Peace, we are looking at the dialogue. We are not talking about Deba. Deba. Sarah, let's hear from you. Can we say health education? Yes, Sarah, let's hear from you.
Doc, please, applying dialogue to improve ANC and skill delivery first. For my opinion, I have to build trust first. Building trust, I have to give the woman peacefully, especially when they come to ANC. I have to make her feel safe and comfortable. Example, good morning,
Sarah,
madam.
you have
How are you?
deviated my question. Though. If it is exams, you go and start to write all these things. You finish, you leave the exams room, you are telling everybody you have written. It will come, you have 40%. What's the crested 3 more than? It's dialogue. Why are you building the trust? Isn't it the dialogue that you initiate? It is through the dialogue that conversation will bring the trust. Oh, the baby, hey, Sister Sarah, midwife Sarah. Midwife Sarah. So by the time I want to talk about your dialogue, they say stop work. Hit the hammer on the nail. Bam. And wada wada. I'm teaching you people how to answer questions as well. Yes, Dorothy.
Please, so instead of you, when you're having a communication with your client, instead of you saying you need to come to antenatal four times or you need to visit 4 times, you can ask the client, how has your pregnancy been for you, like so far? So the answer is the client going to give it to you. That is how you answer next to the client.
If dialogue is a conversation, thank you, Dorothy. If dialogue is a conversation, what they call paper operation, no space. If dialogue is a conversation, then you have to open the conversation. Somebody says that I want to include the husband. So the woman and the man, you have called them. I saw people writing there, but dialogue conversation, one-on-one. Sister, dialogue is not counseling. Dialogue is not counseling. Move deviate you. You see, that's why I asked you people to define dialogue. You have to, that thing, you have to stand on the principle of the dialogue. What the components of dialogue. That is what you have to use to answer this question. The components of dialogue. I've seen a hand up, I'm coming. How do you address fears and misconceptions? Isn't it through dialogue? So how will you initiate that dialogue? Somebody says interactive health talks at. Haven't we been doing these health talks that we have been doing? Now you people have started what you call the pregnancy school. I'm not talking about all those things. So all those things are good. I am just telling you that using the principle of dialogue is a one-on-one interaction. And we've done the talk even with ANC, the traditional ANC. We've been telling people, do this, don't do this. And they come up with a whole lot of things. So now the focus antenatal tailored messages around the person, that pregnant woman that has attended the ANC. Now they are not attending, and you actually want to find out what is happening by using the principle of dialogue. You want us to go back to Deba and go back to pregnancy school. Florence, midwifery now, they ensure confidential. How do you ensure that? How do you ensure that? Let's put our thinking cap. Let's keep thinking through. you see, we said that is a one-on-one conversation, dialogue. And so if it's a one-on-one conversation, and we are going to use that principle of one-on-one conversation, and so somebody says, I go for home visit to do or to dialogue. So you've gone for the home visit, you've met the man and the woman, you have initiated rapport, and you've started the talking. You need, so before somebody said that you have to dispel fear and misconceptions, you have to allow the person that you are dialoguing with to express him or herself. And this is where your active listening comes in. This is where you have to maintain that eye contact, so to have the dialogue and get to the root cause of why people are not initiating the ANC. Sarah, so respect. Respect, what is dialogue? It is in the process of the dialogue that all these attributes and these attitudes will come in. But the bottom line in that is that there should be that one-on-one conversation, that intimate conversation, that will unravel if I begin to take you people one after the other. I have a lot of students that I chat with. And sometimes when we are chatting, most of the time we chat informally, but you realize that we are unable to sometimes even unravel some of the things. We are able to unravel some of them because it's just a conversation. So the person bears him or herself, her heart out to you to tell you, my level 400s that are about to graduate, I was worried that I can teach her, but sometimes their results, it's nothing to write home about. And some of them confided in their reps that they wish I can have that one-to-one conversation with them. They will actually love it to tell me some of the reasons why they are not able to perform in exams. So I didn't do that one-on-one. I did an open forum, and people realize that people also have issues. And so all these things come to play. Until you condemn somebody, you should have a one-on-one conversation with the person. Get to know. When you do that, you realize that sometimes you even pity the person. And so as health professionals, let's try to use this dialogue more. Yes, we are few at our facilities, but I think that sometimes we can try to identify some of these challenges. The reason why a midwife or a community health officer visits home, apart from going to identify diseases, apart from going to solve certain diseases, challenges in the community, the family, you do this to have a one-on-one rapport with clients, and you realize that when you have that, they tend to even understand the system better. Some people think that nurses and midwives, doctors, health professionals sometimes delay. They just want to delay them. But if you have this one-on-one thing with them, you realize they will also come to understand you. Let's go back to ideas of health. The ideas of health is how the recipients of the services we render to them, how they see us. Everybody, anyone that has had a bad encounter with a midwife during delivery will tell you that midwives are witches. And it's because of the perception out there. But if you have a one-on-one conversation with the person, you realize that the person will come to understand you. Me, one thing is that all of you, because I'm straight into me, but I'm not fearful. I'm just straight and disciplined. That's all. If you are able to do your things right, you are okay. So sometimes you need that one-on-one conversations to understand people. And you can encourage free expression of ideas and concerns, Sarah, through the dialogue. Because you agree with me that sometimes in a bigger forum, people are not even listening to you. People are not even listening to you. And so let's keep thinking about the positive ways that we can use dialogue to increase ANC attendance and skill delivery. You can also try dialogue in your workplace. Certain things, even among your colleagues. Even among your colleagues. Sometimes they come to the facility late to take over for you to go. Have you taken time to have a one-on-one conversation with them to know their challenges? So we all have to be doing these things, not even with our clients, but sometimes with our colleagues as well, even with our spouses as well. Sometimes you don't sit down to assume that, say, yes, find time to have that one-on-one dialogue with the person, and then you realize that sometimes the moody that the person has in the house has got nothing to do with you. Sometimes it has got everything to do with maybe the workplace or something that the person is going through. But in this part of the world, because we do not interact with people the more, we tend to assume a whole lot of things. And believe you me, suspicion always reigns a good relationship. When you are in doubt, seek for clarification. When you are in doubt, seek for clarification. In your own life, in your professional life, in your academic life, in your spiritual life, in every aspect of your life, make sure that you seek for clarification when you are in doubt. On this note, let's use the last 10 minutes to rest before our next lecture. Let's use just the 10 minutes to rest before our next lecture. Now I know that we closes at 5:30 instead of 5. I will prepare well and then come next week as well. On this note, enjoy the rest of your evening and have a very, very, very good evening. See you, God willing, next Friday. Bye. Alice, we a cobra. We a cobra. Papa, Alice. We a cobra. I've unmuted everybody. You will see that the talkatives will be talking very soon. And a demo. A dem. Some people, they are talkative in waiting. So the moment you unmute the system, let them say yeah. Let them say yeah.
Thank you.
Those will be no friend about coffee chance and
Bye-bye. Bye-bye.
God
bless you.
Bye-bye.
Bye. We love you.
The best in the wine. The best in the wine. Cobra.
No, you're my sister.
Cobra. Some coffee.
Hey, sister. Oh, goodness, you are laughing. Hey, boy. Dog.
Obi who betting Conquasa Saruaka, who has a moon at cock.
You catch him say.
Manka, obedi kohonza.
Original dog.
Me too obi ankopre ya nto asemu mo ma bai.
Yo, bye.
Bye.